Okay, so now I'll come to know if anybody is in waiting room. And now we are starting with our daily session of these are the daily happy practice sessions. Okay, conducted by Happy Doctor Foundation. Okay, so once we are all set, okay, because as today's topic, you must be aware it is about innovation, right? So when the innovation comes, so that what does that innovation means, and how to do it, when to do it, all that thing we are going to see. Okay, so stay tuned to this video session, which is live on Zoom and as well as on YouTube. Okay, see how what is innovation, why we should think about this innovation in our medical practice. Now, by medical, don't get confused between medical practice, surgical practice, neurosurgical practice, general practice, orthopedic practice, allopathic practice, or any health related practice. All these daily happy practice sessions are applicable. Daily happy practice session, DHP sessions are live conducted by Happy Doctor Foundation, 9:30 onwards. And in the end, we take question answer session in which your questions will be personally answered by me. Okay. So now many of you, they know me, so no need to introduce, but those who are new, who are entering into our conversation and daily happy practice session for first time, just briefly I will tell you, I am Dr. Anil Niray. I entered Nair Hospital in 1979, did MBBS MS from Nair, and they did MCH plastic surgery from KM Hospital. I completed my MCH plastic surgery in 1991. And since then, I am into practice. And as my passion, I entered into management field. I did hospital management. Then I did further specialization, PGBA in brand management, and which has been eye-opening. On this particular why and how of Happy Doctor Foundation, we have got YouTube video. Okay, what you can do, you can visit our YouTube channel and you can see that video. So we will not waste time in a lot of talking about myself. So today what we are going to do is we will be talking about innovation. Now, what is the meaning of innovation that we must see first? Okay. What is the meaning of innovation? Usually we confuse between innovation and upgradation. Okay. I will tell you simple innovation. When you have done your last innovation in technology, I will take pager. Okay, we have used pager maybe in 1995, 1996, right? Yeah. Yes. So over there we have used pager. Now from pager, when we went in for mobile, pager to mobile was innovation. But mobile smartphone, simple mobile, smartphone and iPhone and video phone, that is the upgradation. So get that difference in clearly. You know, your vision should be clear. What is upgradation and what is innovation? Okay. And second thing is, many doctors, they tell me that I am just general practitioner. I don't need this kind of innovation. I am not attached to any big hospital, or I am a consultant, so I don't need. But that is not true. If you do not do innovation in your day-to-day practice, then life of practice is not much. Maybe 1 year, 2 year, 5 year, 10 year, but down the line, the graph of your practice is not like that, but it will be going down, up and then coming down, like that sigma curve. So it will be like that. Now let us see why you should do innovation. So you can start your video, no problem. Okay. Uh, yes. Okay. I have admitted. Admit on. And you can start your video, doctor. Yeah. Yes. Okay. Yeah. Welcome, welcome, Dr. I will unmute in the end when we will take the question answer sessions. Okay. All right. So, yeah, you can start your video. No problem. So, see now, we are talking about innovation. And first, we have seen what is the difference or the misunderstanding between innovation and upgradation. Okay. So, briefly, I will tell you, you were using pager before, right? And now you are using mobile. So, that is the innovation. It's a technical innovation. But when you are upgrading yourself from simple mobile to smart mobile to iPhone mobile or video mobile, that is called as upgradation. Okay, so you upgrade yourself, you upgrade your mobile. But pager to mobile was innovation. Understood? Once you are with me on this basic understanding of innovation and upgradation, then you know what is the exact meaning of innovation in your medical practice. Now, first you have to decide whether you want to innovate or no. So here there are two types of doctor's personality. Doctor's personality or doctor's trait of doing practice. Two types. One is traditional. Traditional doctor means what? He enjoys, see, there is no wrong. We are not classifying doctor according to right, wrong, good, bad. Okay, no. Traditional doctor, he sticks to his own methodology, which he has found useful, effective, safe, result giving in his life of his practice. So he doesn't want to change. That is called as traditional type of practice or traditional way of thinking. Now, futuristic. When you are talking about a futuristic doctor, a doctor who has got futuristic vision about himself, about giving better treatment to his patients, futuristic vision about technology, he will always innovate his practice. He will always innovate. So you have to decide whether you want to become traditional or you want to become innovative. Entirely up to you. There is no competition of any kind. But don't you think it is better to be innovative in your practice? Okay. Because when you are innovative, then something happens. You get more new opportunities. You are acceptable to new technology. See, previously there was so much resistance to even the mobile phones. Mobile phone nahi वापरना चाहिए. What is the use? Even the pager. Doctor used to say, I am staying just on the top room. Okay. And so I don't have any need for pager. I don't have any need for mobile. I am staying at the top and my nursing home is just below. So there is no need. That's what was the thinking. Okay. Who is in waiting room? Okay. So whenever you are having this kind of problem, then always think of innovation. That how I can innovate, how I can give more better service, how I can use technology to the advantage of my patient and for myself. That is very important. Okay. So now let us see how exactly this innovation has to be. Okay. The innovation, yes, great. Yeah, you can ask me in the chat box and I will go through it and we will take the question answer definitely in the end. Okay. We do not leave anybody behind. Okay. Yes. Okay. So I will admit all in participant. Yeah. Great. Okay. Yeah. Now, whenever you are talking about the innovation, the first thing, once it is been taken granted now that yes, you want to innovate your practice. Okay. Now, what do you innovate and how do you innovate? What exactly you want to innovate? You will think that innovation is not for me and I am not a scientist. Innovation is for somebody else. I am a routine practitioner. Or sometimes you will think that I am not even doing anything. No. You have to innovate two things. Number one is skill set, and number two is mindset. Okay. So, number one is the skill set. Okay. Skill set. Simple, I will give you example. Skill set means you are giving different types of injections, intramuscular injections, IV infusions, those type of injections you are giving. Now, is there any better technology to give injection? Look at the blood collection. How we used to do blood collection 10 years ago. And now how we are doing blood collection. Now there are vacuumized test tube. Okay, a needle goes in the vein and vacuumized tube is punctured and blood automatically comes. That is called as innovation. So that is the innovation and you have adapted it, isn't it? So that's why innovation, I wanted to prove the point that innovation is important for each and every one. If you are into medical practice, innovation, you cannot escape only. Second thing is, you want to innovate. This is called as the skill set. Then even our gloves, our gloves, how our gloves used to come 10 years ago, and now you see the technology, examination gloves are different, then surgical gloves are different. The type of sterilization done on your surgical gloves, that is also different. The color of the gloves, if you see nowadays, they are a greenish color or they are light brown color. Last month, I did one case and there was beautiful pair of gloves. Okay, I requested sister to give me one. It was rough, literally it was dotted on one side. Okay, and another side which goes inside, that was the smooth, and it was pre-powdered. So now these are all the technology of innovation which you have to adopt. So these are the external things. These are the external thing, means skill set. Skill set, when you are innovating upon your skills, that means you are push technique, what we call it. That's what you are innovating on. Second thing is what you should innovate on is the mindset. Is the mindset. In mindset, there are certain aspects. Mindset innovation is a part of pull technology. The pull technology or the practice by pull technique, we give that detailed explanation on our Saturday workshop, which happens every day, every week on Saturday at 9:30 p.m. There we give full detail about pull technique, push technique, and this particular Saturday, okay, we are going to have a workshop that is going to give you idea about 5 factors necessary for your innovation. and 4 important factors without which your practice cannot survive, and 3 innovations which are already you are doing, and there are certain boosters which you have to take. So it is called as 5, 4, 3, 2, 1. That workshop is going to happen on this particular Saturday at 9:30. I will send the link to all of you, and you can remind me on WhatsApp also if you don't get the link. And those who are watching on the YouTube, if you are interested, then type I am interested, and I will send you the link in the description box for the Saturday workshop at 9:30. So we are talking about the skill set innovation and mindset innovation. Skill set innovation is from outside, that is done for your patients in your practice. Now let us concentrate on how to innovate your skill set. First and foremost, remember, whenever you are learning any kind of new skill, see to it that that particular skill is going to be helpful to your patient. Don't learn any kind of skill just for the sake of learning. Okay. In fact, I had one student that was almost before COVID, so about 4 years ago, when she came for interview and she wanted to join. She gave me her card. There was each and every qualification was written on her card. Each and every, okay. So then the counseling, it was not for the course, but it was for the life direction. You now what to choose, what you should choose, which line to choose, right from emergency medical services onwards to medical legal to pharmacy vigilance, pharmacovigilance, till cosmetology, trichology, and management also. Everything was there. So at the end of the discussion, she joined with cosmetology, trichology, and then we did further things on the management also. That is the art of medical practice, and like how we are doing now. Okay, the Yashasvi program. That thing also she joined. So that is the we have to decide. So whatever you learn should be useful to your patient, should be useful to your practice. Number 2 thing. Now, second thing is whether it is implementable. Whatever you are learning, that skill, innovative skills, they should be implemented, implementable. If it is not implementable, then it is of no use. The third important thing is you should get benefit out of it, and your patient also should get benefit out of it. Means what? Your patient should get value out of those skills. No? Otherwise, you may be foreign return, you may be this and that, but if you are not able to deliver the results to your patients, then what is the use of that particular skill? So you have to take into consideration the fact that your skill should be useful to your patients, and then only they will value you. Yes, this doctor, he has updated, he has upgraded, he has innovated, and he has brought new technology for our benefit. Example, I will tell you, you also might have been knowing this. See, blood pressure apparatus. How you used to take blood pressure apparatus 5 years ago, 6 years ago, and now you have got electronic, okay, electronic BP apparatus. Same way, there is an electronic stethoscope also. There is electronic stethoscope also. You connect it to the recorder, and then you connect it, keep it on patient's heart. It will record the murmurs or the heart sounds, and it will immediately tell you what the patient is suffering from. Okay, that is called as innovative technique, right? So if you have that particular type of innovation and you use it for the benefit of patient, that is going to increase your value. Agree? Right? Great. Same way in every branch, there are certain innovative techniques. And second thing is what, your job is also done easily. The best example is a patient management system that is called as the PMS. Okay, patient management system. Now, in that, what is happening? You can manage the patient smoothly. You can give the appointments smoothly. There is no tension about giving appointments to your patients. Aram say you can give the appointments. So these are the techniques which are going to enhance your life. Then what do you have? After that, you will have the techniques, okay, that will help in enhancing the treatment's value, enhancing your treatment's value. Now see, I'll tell you simple example. Suppose you are giving any kind of treatment to your patient. Let us say you are giving dressing. Now the dressing is over and you want to tie the bandage. Now, do you know how many types of new bandage has come in market? There are self-sticking bandage. Bandage is self-adhesiveness. You don't have to put any kind of sticking or you don't have to tie knots. That can be used. At the same time, there are certain plasters also available, which when you apply immediately it will set. Whatever position you want, you keep it in that position and yes, it will set in time. You don't have to wait for 10 minutes, 15 minutes. Previously, for setting it fast, we used to use the warm water. But now with that technique it is. So what you should do, find out in your branch what is new. That when you implement, that is the innovation. Innovation does not mean you have to go to some laboratory, do R&D, and then you come out with some research formula. No, that is not the question over here. But the main part is you have to always think of two terms. Number one is patient and yourself. So you must prove your value to your patient. Once you prove your value to your patient, then you prove your treatment's value. How do you find your treatment's value? What does the patient need? See, for any disease, there are more than 1, 2, 3, multiple treatments. What does the patient need? Many a time what happens, you are giving what you are having or whatever is your expertise that we give. Okay. But find out which patient is going to get the best benefit by which method. That you have to find out. And every branch, there are techniques. Because if I start enumerating now, then suppose I tell you about surgical, and if you are not from surgery, then you will get bored. But every branch has got technique. So keep on updating yourself, always, always, always. And find out how you can give best to your patients, how you can enhance your value and your treatment's value. So there are 4 steps in whenever you are choosing to innovate, because I know these questions you are going to ask me. Sir, how can we innovate? How to innovate? So follow this cycle. There is a cycle of innovation. Write down if you are taking notes, cycle of innovation. Number 1, find your patient's need. Number 1 is, that is the first point. Find your patient's need. Because you have to do need-driven innovation. We are not doing research-based innovation. That is not our job. Need-based innovation, or it is also called as need-driven innovation. Okay. See, 4G has come, now 5G has come. In some countries, it is 6G and 7G. Why? What is the need? Yes, there is a need. You want to do the things faster, safer, smoother. Okay, that is the need. So your innovation has to be need based. So you find out your patient's need. Second thing is you have to find out the gap. First thing was need. Second thing is find out the gap. The gap means what? What you are doing currently and what you want to achieve. That is called as the gap. Understood? What is the meaning of the gap? What you are doing currently. Make the list of 1, 2, 3, 4, 5, what you are doing currently. And what you want to achieve. For example, if you are a surgeon and you are doing, say, spinal surgery, you are doing, or you are doing orthopedic surgery. Now, that's what you are doing currently. But in future, what you want to do for your patient? Future, you are thinking somewhere you have read that there is non-invasive or minimal invasive scope has come, which is just 0.5 mm. बस तो वो एक आइडिया दिमाग में रखो, वो अपने को सीखने का है. So I have given you 2 points now. One, what you are doing currently, and second thing is what you want to achieve in future. There is a gap. You have to fill that gap with your innovation. Now that innovation you have to adapt. कि वो टेक्निक इधर आना चाहिए. Do you know how our missiles and all other systems, it has been developed? When that Apollo went up in the sky, okay, so that time people got idea, yes, we can do many things and that technology should come to our country. Then people started thinking on that. So unless and until you become aware, awareness has to come first. That where you are and where you want to go. Where you are, where you want to go. Every 3 months you have to do this exercise. Okay. Every 3 months we have to give this. Okay. Then the next point is you have to develop the process. You have to develop the process, because just by thinking about your end goal, see, the end goal always looks beautiful. End goal always looks beautiful, no? Because when you are appearing for the examination and then you saw how the doctors are doing, so it always looks good. But what is the process? The hard part is adopting and implementing the process, because it needs effort. Dreaming doesn't need any effort. In fact, you should sleep to get the dream. So once you find out the gap, then you have to think on the process. You have to formulate the process. Formulation of process needs planning, needs guidance, needs mentoring from someone who knows how to do it, or from someone who has already done. You have to find out your mentor, your guide, depending on your gap. Sometimes, many a time it happens that you choose one, then you choose more. Suddenly your aim changes, your focus changes. So that's why you need someone who will make you accountable. Accountability has to be there while you are considering the innovation, because you are going to fill the gap where you are now and where you want to be. That is called as the developing the process. And then once you have developed the process, don't start it on large scale, but you do pilot experimentation. Pilot experimentation, that is called as the prototype testing. Prototype testing. Don't go on doing it for 10 patients. No, do it for 1 patient, 2 patients. Do apply that particular dressing example I am giving you. I told you new dressing just apply it on one patient, get the feedback, ask the patient how did you feel, okay, ask the patient how did you feel, yeah, okay, then satisfactory result, then no problem, go ahead with more, right? And all that thing is very important. So after doing that, you have done the pilot study also. Then you think of two things. Number one, commercial viability. That is very important. Whether your innovation, whether your process is commercially viable or no, because you should get some commercial benefit, no? Otherwise, all your mehnat, all your hard work will go waste, and then you will get frustrated. Fifth point is improvement cycle. How you can improve, how you can improve on your skill level, how you can improve on your mindset. That is what is important. How you can improve. Constantly improvement is necessary. So assessment, then comes a reassessment, and then comes a retrying. All these 5, 6 steps are very important. So now what you can do, think of which type of innovation you want to bring in your practice, which is going to help your patient and which is going to in turn help yourself in improving your credibility, in making patient's life easier. That you have to think it for each and every of you for your own practice. Because why I am telling you, this is like assignment. And in our daily practice, when we meet, it is like one-to-one interaction and assignments. Okay. This is, what I am telling, this is not a management class that I'll give you 1, 2, 3, 4, 5, 6. Okay, then you have to read it and give examination and then get the good marks. No, this is your life's examination. What type of innovation you want in your practice? Write down 1, 2, 3. Once you have written that in one column, then find out as far as that particular innovation is concerned, what is your current status and what you want to achieve, how much is the gap. Then write down what should be the process. Then write down who can guide you in that particular process, whether that is your teacher, from your hospital, from your medical college, from your friend, or you need a guidance, you need a mentor. Write down. Then implement, but implement on experimental basis on 1 or maximum 2. Take the feedback, then improvement cycle, then again rethinking. This is how you innovate. And don't worry, even if you might think that, sir, from tomorrow I am not getting any idea today. Tomorrow also it seems difficult. Don't worry. Once it is at the back of your mind, then see what your brain doesn't see anything. Your brain doesn't think anything. What is at the back of your mind that you see, and you pay attention to that. So just keep this thing behind your back, behind your mind. And mindset, that is what we call it, the pull technique, the pull type of practice. Mindset, your vision, your mission, your goal, what you want to achieve, that should be clear. 3 months goal, 6 months goal, 1 month, 1 year, 5 years. So now I will unmute all of you and you can ask your doubt so that your queries will be solved. Yeah, Dr. Muhammad Amir. Yeah, Akruti. Yeah, you can unmute yourself.
Yeah.
Yeah, you want to ask related to this, how
So,
you want, yes.
so related to, so there was a case today in the clinic.
Okay.
So the patient had an full, the face was covered with active acne, and
Okay.
pus was there. So I was confused in planning the treatment, how to go ahead with with the treatment.
Yeah. Yeah.
And
See, what was other problem with the patient?
sir, pigmentation was also there.
Right. Right. So now see, in such patient, you have to follow the protocol. Follow the protocol. Never compromise on your protocol. I'll do one thing. Yeah. Now, those who are watching on YouTube, you can click on the description box link so that you can register yourself for Saturday workshop of how exactly step by step innovate your practice and have growth and successful practice. It will be on Saturday 9:30. Plus, when you register, you will get 2 ebooks free. And at the end of your workshop, another 2 ebooks will send you by WhatsApp. Okay. So with this, I will stop the streaming for the YouTube, and you are welcome in our tomorrow 9:30 p.m. daily happy practice session. You can become member of Happy Doctor Foundation also. How you can become member of Happy Doctor Foundation and subscribe to all our services that you will come to know on Saturday. Okay. So for YouTube, I am now coming out and I am stopping